a tingling in your hands, the pins and needles that wake you up at night, the numbness that creeps into your fingertips while you're reading or driving, the strange burning sensation that comes and goes without any obvious cause is not carpal tunnel. It's not poor circulation, and it's not just something that happens when you get older. In the vast majority of cases, that tingling is your peripheral nervous system sending you a distress signal, telling you in the only language it knows that the nerve cells responsible for carrying sensation from your hands to your brain are being damaged, are losing their protective insulation, and are slowly dying. And if the cause isn't identified and addressed, the tingling that you're currently dismissing as a nuisance will eventually progress to permanent numbness, chronic pain, muscle weakness, and loss of the fine motor control that you depend on for everything from buttoning a shirt to holding a grandchild's hand. Peripheral neuropathy, the medical term for this kind of nerve damage, affects roughly 30 million Americans. And according to the Foundation for Peripheral Neuropathy, it is one of the most underdiagnosed conditions in modern medicine, often missed for years, while patients are told they have carpal tunnel syndrome, poor circulation, or simply that their symptoms are a normal part of aging. But here's what most patients don't hear, and what I wish more doctors would say. In many cases, peripheral neuropathy is caused or significantly worsened by nutritional deficiencies that are completely correctable. And when those deficiencies are identified and addressed, the nerve damage can be slowed, halted, and in early stages actually reversed, because peripheral nerves, unlike the nerves in your brain and spinal cord, have a remarkable built-in capacity to regenerate if given the right conditions and the right raw materials. Today, I want to show you exactly which nutrients your nerves need to repair themselves, which foods deliver those nutrients most effectively, and why the tingling you've been ignoring might be the most important health signal your body has ever sent you. The first and most critical nutrient is vitamin B12, and its deficiency is the single most common nutritional cause of nerve damage in adults over 60. Vitamin B12 is essential for the production and maintenance of myelin, the fatty insulating sheath that wraps around nerve fibers the way rubber insulation wraps around an electrical wire. Without intact myelin, nerve signals slow down, misfire, or fail to transmit at all. And the tingling, numbness, and burning sensations that characterize neuropathy are the direct result of this insulation breaking down. When B12 levels drop below what the nerves need, and an estimated 10 to 25% of adults over 60 are B12 deficient, often without knowing it, the myelin sheath degrades progressively, exposing the bare nerve fiber underneath to damage that becomes increasingly difficult to reverse the longer it goes untreated. A study from the University of Southern California confirmed that B12 can stimulate nerve regeneration by promoting axon growth, the physical extension of new nerve fiber from a damaged neuron toward its target. And research published in the Journal of Neurology found that B12 supplementation improved nerve conduction speed and reduced neuropathy symptoms in 68% of participants, with some patients experiencing significant or complete recovery of sensation when the deficiency was caught early enough. There are several reasons why B12 deficiency is so common after 60 and why it so often goes undiagnosed. First, the stomach's production of hydrochloric acid and a protein called intrinsic factor, both of which are required for B12 absorption, decline with age, meaning that even people eating adequate amounts of B12-rich food may not be absorbing enough of it. Second, proton pump inhibitors like omeprazole and lansoprazole, among the most commonly prescribed medications in the over 60 population, further suppress stomach acid and dramatically reduce B12 absorption with long-term use. Third, metformin, the first-line diabetes medication taken by tens of millions of Americans, has been shown to lower B12 levels over time. And fourth, the standard blood test for B12 has a notoriously wide normal range that can miss functional deficiency, which is why asking for a methylmalonic acid test, which is a more sensitive marker of cellular B12 status, can catch the problem when the standard test says everything is fine. The richest food sources of B12 are beef livers, which contains more B12 per ounce than any other food, clams, sardines, trout, salmon, and eggs. The key distinction in supplementation is the form. Methylcobalamin is the neurologically active version that the nervous system can use immediately for myelin repair, while cyanocobalamin, the cheaper form found in most drugstore products, must be converted before the nerves can utilize it, and that conversion becomes progressively less efficient with age. For anyone experiencing tingling or numbness, methylcobalamin at a dose of 1,000 to 5,000 micrograms daily, sublingually, meaning dissolved under the tongue for direct absorption into the bloodstream, is the approach most commonly recommended by neurologists specializing in nutritional neuropathy. The second nutrient your nerves need is omega-3 fatty acids, and they protect nerve cells through a mechanism that goes beyond inflammation. The membranes of your nerve cells, like all cell membranes, are made of phospholipids, and the composition of those membranes directly determines how well the nerve conducts signals, how flexible and resilient it remains under stress, and how efficiently it communicates with neighboring neurons. DHA, the long-chain omega-3 found in fatty fish, is one of the most abundant structural fats in the nervous system, comprising roughly 40% of the polyunsaturated fatty acids in the brain and a significant proportion of peripheral nerve membrane composition. When DHA levels are adequate, nerve membranes stay fluid, flexible, and electrically responsive. When they're depleted, as they increasingly are on a diet dominated by omega-6 fats from processed vegetable oils, the membranes stiffen, signal transmission degrades, and the nerves become more vulnerable to inflammatory damage. Research has shown that omega-3 supplementation can meaningfully improve nerve conduction velocity, the speed at which electrical signals travel along the nerve fiber, measured directly through electrodiagnostic testing, and significantly reduce the inflammatory cytokines that drive nerve degeneration in conditions like diabetic neuropathy, chemotherapy-induced neuropathy, and age-related peripheral nerve decline. A study in patients with diabetic neuropathy found that omega-3 supplementation not only reduced pain and tingling scores, but also improved measurable nerve function on electrophysiology tests, meaning the improvement wasn't just subjective symptom relief, but an actual documentable improvement in how well the nerves were conducting signals. Salmon, sardines, mackerel, and anchovies remain the best whole food sources of preformed DHA and EPA, and eating 2 to 3 servings per week provides enough of these critical fatty acids to maintain the structural integrity of nerve cell membranes throughout the peripheral nervous system, while simultaneously dampening the inflammatory processes that accelerate nerve degeneration. The third nutrient is alpha-lipoic acid, and it attacks nerve damage from a direction that no other antioxidant can match. Alpha-lipoic acid, ALA, is unique among antioxidants because it is both fat-soluble and water-soluble, which means it can cross nerve cell membranes and protect both the fatty myelin sheath on the outside and the watery interior of the nerve cell itself. Most antioxidants can only operate in one environment or the other. Vitamin C works in water, vitamin E works in fat, but ALA works in both, giving it access to every compartment of the nerve cell where oxidative damage occurs. A 2021 meta-analysis published in the journal Nutrients found that ALA supplementation reduced neuropathic pain scores by 53% across over 700 participants, a magnitude of relief that rivals many prescription neuropathy medications. ALA also improves blood flow to peripheral nerves by enhancing nitric oxide production, which is critical because one of the primary mechanisms of nerve damage, and particularly in diabetics, is reduced blood supply to the tiny vessels that feed the nerve fibers. When those vessels are constricted by inflammation and oxidative damage, The nerves starve for oxygen and nutrients, and the tingling begins. ALA opens those vessels back up while simultaneously neutralizing the free radicals that damaged them in the first place. Spinach, broccoli, and organ meats are the best dietary sources of alpha lipoic acid, though the amounts in food are relatively modest compared to supplemental doses. For anyone with active neuropathy symptoms, a supplement of 300 to 600 milligrams of ALA daily in the R-lipoic acid form, which is the biologically active version, is the dose range most commonly used in clinical studies alongside a diet rich in the food sources. The fourth essential nutrient is folate, and its role in nerve health connects directly to the DNA repair conversation we had in our SEEDS video. Folate, vitamin B9, is required for DNA synthesis in every dividing cell in your body. And when peripheral nerves are damaged and attempting to regenerate, the Schwann cells that produce new myelin and the neurons that are extending new axons depend on adequate folate to replicate their DNA accurately and divide successfully. Without sufficient folate, the regeneration process stalls at the most fundamental level. The nerve wants to repair itself but can't build the new cells it needs to do so. Research has also linked folate deficiency to elevated homocysteine, the inflammatory amino acid that directly damages blood vessel walls and nerve tissue, creating a double hit where the repair system is disabled at the same time the damage is being accelerated. Spinach, asparagus, lentils, and broccoli are the richest food sources. The fifth nutrient is vitamin E, and it protects the one part of the nerve cell that's the most vulnerable to aging. Vitamin E, specifically alpha tocopherol, is a fat-soluble antioxidant that concentrates in lipid-rich tissues, and there is no tissue in the body richer in lipids than the myelin sheath that insulates your nerves. Vitamin E embeds itself in the myelin membrane and acts as a shield against the lipid peroxidation, the chain reaction oxidative destruction of fats. That is one of the primary mechanisms through which aging degrades nerve insulation. When vitamin E levels are chronically low, the myelin breaks down faster than it can be rebuilt, and the tingling, numbness, and loss of sensation that follow are direct consequences of that undefended membrane deterioration. Sunflower seeds, almonds, and avocados are the richest food sources of alpha tocopherol. And the sixth critical nutrient is magnesium, and its role in nerve function ties directly to the nerve signal itself. Magnesium regulates the flow of calcium ions through nerve cell channels, and those calcium channels are what control whether a nerve fires a signal or stays quiet. When magnesium is deficient, nerve cells become hyperexcitable. They fire too easily, too often, and at thresholds that wouldn't normally trigger a signal, which produces the tingling, twitching, cramping, and burning sensations that characterize neuropathy, even when the nerve fiber itself may not be structurally damaged yet. This is why magnesium deficiency can mimic or worsen neuropathy symptoms, and why correcting it sometimes provides dramatic relief within days to weeks. Pumpkin seeds, dark chocolate, spinach, and almonds are the best dietary sources, and magnesium glycinate is the supplemental form best suited for nerve-related symptoms due to its superior absorption and calming effect on the nervous system. Here's what I want you to do if you've been experiencing tingling, numbness, or burning in your hands or feet. First, don't dismiss it. Don't let anyone tell you it's nothing. And don't wait for it to get worse before you take action. Because peripheral nerves regenerate slowly, roughly 1 inch per month, and the sooner you address the underlying cause, the more completely the nerve can recover. Ask your doctor for a B12 level, a methylmalonic acid test, which catches B12 deficiency even when the standard blood level looks normal, a fasting glucose and hemoglobin A1C to rule out diabetes, and a comprehensive metabolic panel that includes magnesium. These simple blood tests can identify the most common correctable causes of peripheral neuropathy, and what they reveal could change the entire trajectory of your nerve health. Then start building a diet around the 6 nutrients we just discussed. B12 from eggs, fish, and liver for myelin repair and axon regeneration. Omega-3s from salmon and sardines for nerve membrane integrity and anti-inflammatory protection. Alpha lipoic acid from spinach and broccoli for dual compartment antioxidant defense and improved blood flow to nerve tissue. Folate from leafy greens and lentils for the DNA synthesis that nerve regeneration demands. Vitamin E from sunflower seeds and almonds for protecting the lipid-rich myelin sheath from oxidative destruction. And magnesium from pumpkin seeds and dark chocolate for calming hyperexcitable nerve channels and restoring normal signal regulation. Your peripheral nerves are capable of healing themselves. They are among the few structures in the adult nervous system with genuine regenerative capacity. But they need the right raw materials delivered consistently over weeks and months. And every day you wait is a day the damage extends a little further down the nerve fiber and becomes a little harder to reverse. The tingling in your hands isn't something to sleep on. It isn't something to Google and forget about, and it isn't something your body will fix on its own without help. It's a signal. Treat it like one. Share this with someone who needs it. Subscribe so you don't miss what's coming next. And as always, take care of yourselves. I'll see you in the next one.